Have you ever heard of degenerative disc diseases before? Well, this is a very serious health condition. Should you experience any of the signs and symptoms that I am going to mention, try as much as possible to visit your physiotherapist for detailed assessment and then treatment. Well, someone may ask, what is degenerative disc diseases? This is a medical condition or a serious condition that occurs when spinal disc deteriorates, leading to pain and then stiffness. So this is what goes into it. The spinal disc that acts as shock absorbers between the vertebrae, talking about the spine, it loses their strength, their elasticity, and then the height due to wear and tear of the disc. There are a whole lot of things that come into the wear and tear of the disc, and I'm going to send you guys through that. Stay tuned. So now you may want to know what some of the causes are and then the risk factors that may predispose you to this condition. Now, some of the causes are as follows. Aging, that is old age, actually leads to this. So disc kind of loses their moisture and then flexibility. The disc is actually made of a flexible structure, that serves as a cushioning between the vertebral bones, act as shock absorbers, that is between the vertebral bones. So protecting the one vertebral bone from the other. So protecting one vertebra from the other. That is one main function of the vertebra. And then secondly, genetics, that is family history, increases the risk also. And then injury or trauma, this is a most common cause. So that is when there is a sudden damage which kind of accelerates degeneration. When there is a sudden damage as a result of car accidents, falls, slips, and then all that activities that kind of have a serious impact on the spinal cord and its structures that makes it up. Talking about the disc being an inclusion. And then we also have obesity, that is excess weight strains spinal joints also. And then we also have sedentary lifestyles, when inactivity sets in, it also accelerates degeneration to take place or to set in as well. So yes, someone may ask, what are some of the symptoms that he or she should be expecting when he or she suspects this condition setting in? So there are a lot of symptoms that you can be experiencing or you should be expecting, and they are as follows. First one is back pain, depending on the site in which the pain is being felt by the patient. So it's more of subjective, what the patient is going to say and then what the patient is experiencing. It can be around your neck, it can be around your back, talking about the chest, behind your chest. So talking about the thoracic region, to be specific. And then it can also be at the low back. Remember, the spine runs right away from the neck down to your low back. So when you experience back pain, it is a symptom of this degenerative disc disease. And then stiffness also is the second one. The third one is limited and then reduced mobility. The fourth one has to do with numbness or tingling sensation. That is when there is a nerve involvement over there. This situation can lead to a compression on a nerve, which can actually cause a nerve injury, which in turn enables the patient to feel this numbness or tingling sensation. Whenever you feel this numbness or tingling sensation, then you should suspect a nerve involvement over there. And then the last one I'm going to talk about is muscle weakness. You kind of feel like your muscles that have been affected, talking about the muscles that are being innervated by the nerve that has been injured, kind of reduces its role, talking about its function, which in turn leads to low activity performances by those muscles. Okay, but you know what? You can actually prevent this condition by your own self. Your lifestyle modifications really help in preventing this condition. Okay, and so let me send you through some few prevention tips that you can take into consideration. The first one has to do with regular exercises, and not just any exercises, but strengthening exercises and then stretching exercises. The second one has to do with the maintenance of healthy weight. This one has to do with you and then your dietitians, okay, trying to draw a very good diet plan for you so you can stay healthy. And then you need to quit smoking as well. It's very bad for your health. It's not good for your health. Just stop smoking. And then the fourth one has to do with adapt to good posture and then body mechanics. Okay. The last one has to do with ergonomics and then workplace setup, so as to prevent some work-related musculoskeletal injuries. So finally, what are some of the roles of physiotherapy in these conditions management, or in managing this condition? What are the roles of physiotherapy? And you know what, I'm a student physiotherapist, and so just like I am an advocate for physiotherapy. Okay, yeah, so if I don't talk about physiotherapy, the video won't end, and then it wouldn't be interesting as well. So I need to fill in that gap. Yes, so the roles of physiotherapy in managing degenerative disc diseases are as follows. The first one, we physios, as part of our treatment, we try as much as possible to educate our patients on posture, proper body mechanics, and then what? Functions. Okay. We try as much as possible to educate the patient on the condition, and then tell the patient how to adapt to proper postures and then proper body mechanics. The second thing that we are considering is pain management. This is where modalities, specific modalities depending on the condition. Then the third thing that we also consider here is to mobilize the various joints, okay, that has been affected. So we bring in mobility exercises to improve range of motion and then also improve stretching as well within the various muscles that are responsible for movement to take place. And then we are also there to make sure we bring in stretching exercises so as to, one, improve core, back, and then gluteal muscles function. And then the last thing that we are going to do or consider is functional training. We do a lot of things purposely to make sure you improve in your daily activities. Okay, won't you be happy when you, feel free among your various colleagues that you stay with, play with, crack jokes with? And then wouldn't you be sad when you are eliminated from your colleagues as a result of this condition? Thanks for watching. This brings me to the end of the video. Consult your therapist whenever you are experiencing any of these symptoms. Don't forget to subscribe, like the video, and then comment. See you next time. Bye.